Yeah.
Gerard, I just want to ask you the first question. Maybe you mentioned at some point in your speech there to some of the people that were gathered here tonight about there's a hospital in Niagara that needs to be built. Yeah, maybe you could elaborate a little bit on that.
Well, I think there's a consensus forming about a new hospital that would make sure that South Niagara gets the highest quality service possible. And as I understand it, there's starting to be a pretty good, strong agreement about that. So the Liberal government has a good track record of improving services. What I worry about when we have a mix of rural and urban is we make sure that people feel that they're good, whether they're heading to retirement or just getting a bit older, that those services are there and readily available. And it makes a ton of sense for us to do that. Otherwise, people tend to move in only exclusively to larger centers and so forth. So, it seems like a plan. If it's gaining local support, I think it's something that the province can get behind. So, and in terms of the timetables and so on, I think that's something that, I don't know, Kim, if you can speak to that. But,
the key is, and you said it, Gerard, the key is to get a consensus.
Yeah.
And that's been a bit of a challenge. Things were going smoothly, and then a couple of the municipalities have indicated they're not quite in support of that location. And so it's similar to what you said. You get a consensus, you work together. I'm being positive, but it's the right thing to do. And I know we've talked about it, and Gerard has mentioned it's something that he would support because the community wants it. They're behind it.
And the thing, the only condition I have for new hospitals, they have to really link up with the community care. I mean, that's what, there's only so much of what people is going to benefit from that is in those rooms. We all want it. We want it to be, we want an emergency. We want an ability to have acute care. But we also really need is help that helps us participate more in society, turns us around faster, helps us get well. And those things can be delivered in a whole bunch of different ways. And, we've got we've instituted the family health teams, we've got community health centers, and we also have, I think, a commitment to home care where we don't, get so much institutions, but rather the ways that people can stay in their homes for as long as possible. And these are things that we've learned and started to implement really well, but they have to be adapted to work for each region of the province. And I assume that the hospital will be one of the places. Every new hospital is going to have hard links with the community care to make sure that it's seamless for patients.
Gerard, why do you think you're the best person for the Premier's job?
Well, I think I'm the best Premier for these times. We need to be working at a level that's effective. I have a track record of delivering difficult outcomes in a way that actually brings people together. I don't think there's any other way that we're going to get the province operating on all cylinders. I mean, we really have to find a consensus agenda. And that means, one, that yes, the opposition parties, at least to some extent,